Alright, so you have clicked on this video because you have knee pain, or you have been diagnosed with or suspect that you have knee arthritis. I'm glad you're here because it is possible to reduce your pain, improve your function, and maybe even delay or prevent surgery. Hey, I'm Sam the PT, and today we are going to be discussing great stretches and exercises to do if you have knee arthritis. And later, I'm going to be going into exactly what knee arthritis is and what to expect. Let's get going. Alright, so the first stretch we're going to go over is for our calf muscle. Alright, so this is on the back of the lower leg. People frequently ask me, why am I stretching my calf for my knee pain? Well, one of your main calf muscles actually comes up and crosses the back of the knee joint. So if it gets tight, it's going to pull on the knee and affect your range of motion and affect the way that your knee functions. So it's really important to stretch this guy, okay? The way that I'm going to stretch it here is I have this little wedge, but I'm also going to show you how to do it with a rolled up towel if you don't have a wedge, but this was just ordered off of Amazon, okay? So all you need is something elevating your toes higher than your heel. So what I'm going to do is put my foot on this wedge, and then I can hold on to the wall for balance. I'm going to step through until I feel a calf stretch. Things to remember here are keeping your back foot straight. Don't let it toe out. You won't get as good of a stretch. Keep that foot nice and straight, and we're going to keep the knee straight as well. Okay, so that's going to get you the best stretch. You're just going to lunge forward until you feel a little pull in your calf. You're going to hold this one for 5 seconds, and then you're actually going to go to the left and kind of lunge your hips forward at an angle. 5-second hold here, and then you're going to go to the right. Same thing. So the reason we do the angles is because the calf is not just one line. The calf goes around, it has, the lateral side, the medial side, and so we're able to get all the different angles by doing this 3-way calf stretch. Okay, after you go through 5-second hold 5 times, you're going to switch legs. So let me just show you, this is how you would do it with a towel. I just rolled up a hand towel here. You'll put that down. Make sure it's not just your toes on it. You want the ball of your foot on the towel. And again, just stepping through till you feel that stretch. All right, so this next stretching our quad muscle, this big front thigh muscle. All right, so this one is really important to stretch because not only does it cross the hip joint here and can tighten your hips, but it crosses the knee joint, and if it gets really tight, it starts pulling on your kneecap. All right, and that can contribute to pain. So in order to stretch this, you just have to put your leg up on something behind you. So here I've got a table, and I'm just going to put my leg up. But what you can use at home is the back of your couch, maybe the arm of your couch or your bed, whatever seems like a good height to you. All right, so from here, you're going to press your hips forward and keep your chest upright to get the most stretch. If you are sitting back into your leg and allowing your hip to flex, you will not feel as good of a stretch. This actually just kind of hurts my knee. So from here, again, press the hips forward, chest up, and lean back, and I feel a very strong stretch in the front of my thigh. So I'm going to hold it for 5 seconds, and then just like the other ones, give yourself a break, and then go through 5 times total. And then of course switch legs and do it on both sides. Next, we are going to do a mobilization for our kneecap, okay, or our patella. This is very important because it plays a huge part in the mobility of your knee. Whenever we're walking or whenever we're moving, if our knee is straight or bent, the patella is doing something. All right, so when our knee bends, the patella actually moves down a little bit, and when our knee straightens, the patella moves up a little bit. And with knee arthritis, it's very common for this bone to get stiff. It does not move like it should. So the patella should be able to go up and down and left and right pretty freely in order for it to be as pain-free as possible. And so if you have knee arthritis and your patella starts getting stiff, here is a great way to mobilize it. You're just going to use your fingers here, nice and light, and press it back and forth, left and right. And then you can kind of use a pincer grip here and go up and down. It doesn't move quite as much up and down. And another thing to remember is you really won't be able to move it if your knee is bent or if you're tensing your muscles. So if my knee's bent, nothing is really happening here. So you want to be nice and straight, relaxed leg, do not contract your quad, and then you're going to be able to mobilize it. So here's what it looks like up close. You should try this mobilization for about 1 minute in each position. So go left to right for about a minute, and then switch and go up and down for about a minute. And this will help you mobilize your patella or your kneecap in order to help your knee movement. Okay, this next movement is both an exercise and just something to be aware of throughout the day. So something I see a lot in my practice is the way people squat is terrible. What we call that is a knee-driven squat versus a hip or glute-driven squat. So let me give you an example. A lot of the times I say, just show me how you squat, and this is what it looks like. Knees straight forward, heels come up off the ground, which puts all of the force on your knees and really activates my quads. Okay, so we want to avoid that as much as possible. What it should look like, a hip or glute-driven squat, is initiating the movement from your hips like you're gonna sit back into a chair. My weight should be on my heels and my feet should be as straight as I can. I'm gonna sit back and then go as low as is comfortable for me, okay? And so another modification you can do is if you have right knee pain or right knee arthritis and it kind of hurts to squat, you're just gonna put that affected leg a little bit forward, like so. So my right leg is just a little bit forward. Now, when I sit back or when I squat, most of the weight is gonna go on my left leg. So I can use this technique to exercise, I can use this technique to sit on low toilet seats or in low chairs, anything, or I can even use it to stand up from difficult low seats. Okay, so if you're using it for that purpose, just be mindful that whenever you go to sit down or squat down to pick something up, do not go forward with your knees, go back with your hips, okay? If you're gonna use it as a squat exercise, you can go feet even, or like I said, the painful leg a little bit in front, and you can just squat here. You can go 3 sets of 5, 2 sets of 10, whatever is fatiguing for you and whatever is comfortably difficult. And our last exercise for the day is going to be a strength exercise. One of the last main components that I see in people who have knee pain is that their hips are really weak. All right, so this is going to be what's called a sumo walk or a resisted side step. All right, so for today, I'm just using this mini band or looped resistance band, and this is gonna be placed around my ankles. The first thing you wanna check is that your feet are pointed forward. Having your feet toe out is cheating, so try not to do that, okay? The next thing we wanna make sure of is that same concept that I discussed in the squat. We wanna make sure we're not knees forward and butt turned off here. You really wanna make sure you're sitting back in this mini squat position like you're gonna sit back into a chair, okay? So I've got my feet straight, I've got my hips back, and from here, I'm gonna take slow, controlled side steps. So we'll go to the left first, and then you can come back to the right. All right, and I feel already within the first steps, my side hips, my gluteus medius is activating. All right, another common thing that I see people do is they'll step and slam their foot. They'll let it slide, right? You really wanna control the band. Nice, slow steps here. My feet are forward, my hips are back. If this is too difficult for you, you can move the band up above your knees. So the higher you move it, the easier this is gonna be. Now, because the band is up higher, it's closer to the muscle that's working, making it easier. Okay, again, we're keeping feet straight, knees straight. I don't wanna see any knees caving in or going way out to the side. All right, knees should be tracking towards your big toe. So lastly, the reps on this one are really just whatever is most difficult for you, an appropriate challenge. So if you go all one way first, you're really gonna burn out one side. If you wanna just alternate, that might be a little bit easier. My recommendation is maybe starting with an alternating step 20 times. Doing these stretches at least once a day, twice a day is better, will help to reduce your muscle tightness, improve your gait, and reduce the force in your knees. Now, let's get into the good stuff. What is arthritis? Arthritis is the wearing down of the cartilaginous surfaces of a joint, meaning that the slippery surfaces of the two bones is not there as much as it used to be. Hence, the phrase you have probably heard before, bone on bone. Once this starts to happen, our bodies can go into an inflammatory response, which increases swelling and can build up osteophytes or bone spurs. These reactions contribute to loss of range of motion and that stiffness you feel when standing up after sitting for a while. If you're wondering how you got arthritis in the first place, well, that's a great question. There is no one cause to arthritis, but there are common contributors. These include genetics, past knee injuries, high volume of running or high impact sports, and of course, age. The more miles we put on our joints, the more wear and tear we get, which is totally natural. One of my biggest pet peeves is when people go to see their doctor or they go get an x-ray and they're told, oh, you have severe arthritis. And so they come to me all freaked out, thinking it's the end and that their leg's about to fall off. I'm here to tell you, so many people have arthritis. Many people have it and they don't even know it. Bottom line is, arthritis is very common and it's not something to be afraid of. However, if your knee pain is taking over your life and is significantly limiting your activity level, it might be time to consider a total knee replacement. Keep watching in future videos because I will be covering total knee replacements, what to expect, and other questions leading up to this surgery. Something I like to keep in mind is this: we expect to age on the outside, but then are surprised when we age on the inside. I'm here to tell you that aging on the outside as well as the inside is normal. But here on this channel, I'm gonna do my best to help you on your journey to a pain-free life. All right, well, that's all I have for today. Be sure to hit that subscribe button and like this video to keep watching for more helpful stretches and education. Until next time, peace.